Hi, this is me, Neda, from Sweden. Yeah, my last video was quite depressing. I know that. Um, the thing is, you can't really. How many days can you fake it? Sometimes you just give up and you have to show the real you. I try to smile and um, make your experience of watching my videos, in a happy way, and that not get more depressed. But and that anxiety people and people with diagnosis, even them, they can smile. So that is my basically, that's what I try. Um, yes, I have a very important update regarding. Sorry, I do all. I do this all the time. I have to wash there, not here. Yeah. Um, I have a huge update on Rtms. When I started it, I actually told both the nurses and the doctors, not once, not twice, not thrice. I think, I don't know, I was saying this all the time, that my my depression is because of my anxiety. It's not vice versa. So I'm actually not depressed. Yes, I am depressed, but I'm depressed because I have anxiety. And anxiety, what it does is that, it limits your, daily life. And you may have so many goals in lives, and, you want to, uh, I don't know, become someone, big, or which I used to, like, before my anxiety got bad. I had huge dreams, like studying in Oxford. I graduated in Sweden 2 years earlier than other kids. Um, so yeah, I had a lot of dreams. So I told them, look, uh, RTMS is not like, you're just, it's not like someone is massaging your head. It is, magnetic fields, going into your head, and it can, I don't know if it can be dangerous. Every time I've told them that I'm having such and such, symptoms, they totally ignored it. They were like, no, this cannot be by RTMS. And then I stopped complaining. But I did notice that I started to become very, even my family noticed it. I started to become very like, uh, uh, how do you say? This is the problem when you speak several languages. I wasn't present. Do you understand? I was in a room drinking coffee. I was, not having anxiety or something like that. But the thing is that I was not communicating. Or if someone was talking to me, I literally was in my own world. And despite me trying to explain this to them, they did not listen. And the other part is that I told them that I'm having issues coming back and forth, because the treatment is just 3 minutes and 8 seconds. So you're literally, traveling for, like, it takes half an hour to travel there, and then half an hour back, I think a little bit more than 1 hour total. And then you are just taking a 3 minute 8 second treatment. Of course, it's worth it if it's working, but again, um, after seeing me for like, I don't know, 14, 15 times, um, they started to write on my journal that she's not depressed, and this treatment may not help her because her problem is are a bit different. And today, I stood out for days, and I noticed I was going down the hill again. I had some good time before I started this treatment, and I was very happy. I was like, okay, now maybe I have found the right medication, and the how much the dosage and all that. But when I started this, I started getting extremely tired. You name it, and they were not accepting it. Like, I can't understand that a week before starting RTMS, I am okay. Of course, I'm not perfect because I have my issues, but in that imperfection, I hope that is a word. I had some sort of relief every now and then, and starting this was not giving me that. It was not giving me that. I was coming home, I was tired, I was exhausted, I didn't want to talk to my kids, I didn't want to communicate with my husband. I mean, I could sit there, I could be present, but were I listening? No. And I think my daughter took the most advantage of it because she came later on and she was like, oh, I told you last week that I'm going to go to this movie and blah, blah, blah. And I'm like, what? When did you say that? But yeah, so that's what was happening. So I chose today to both either take a break from it, or this is not for me, because as I said from the beginning, I'm not depressed. My issue is anxiety, and the anxiety makes me depressed. So you have to understand you have to treat the anxiety in order to stay away from other stuff like depression and all that stuff. And if you don't treat the anxiety, then of course it will show up as a depression. And that's was happening with me. And I told them a million times, like, for God's sake, is this going to help me with anxiety? For a lot of people it has helped, the ones I've been reading. A lot of people, around 50%, it has done nothing. 80%, I think, has seen some sort of positivity, and 50% have actually almost been cured. But it's a sort of treatment that you can't rely on it for the whole life. Like, if you do it once, there will be a moment future that you might have to do it again. As my nurse said, that there is a lot of people who come back and do it. Um, what can I say? I found my anxiety getting worse. Depression, I don't know. As I said, like my issue is anxiety. When I don't have anxiety, I'm the happiest person in the world. Um, yeah, so I called them up today. It took me a lot of courage to do that because you're always what do I say? You're always like, oh, she didn't do the treatment we gave her, and she stops every now and then, and she complains a lot about side effects and how will we help her, and then yeah, so on, so on, and so on. So that's why I wanted to actually continue 4 weeks at least. But I did 14 sessions, and the only thing I could notice is fatigue and more anxiety and a feeling of just being in the room, not, not communicating, just listening, or acting to listen. And then now this is the third day that I haven't done it because it was weekend it was like Saturday, Sunday, they don't do the treatment. And today was Monday, and I called in and I said, I'm not sure if I want to do this. And of course, they were pissed off, not happy. But I was expecting it. So I personally don't think this is. I personally don't think this is treatment for anxiety. I may be totally wrong. Totally wrong. You may have anxiety and you have. It can be that you have depression and depression is causing anxiety. The vice versa. But my issue is my anxiety that's causing insomnia, that's causing headaches, and that's causing sadness, that's causing depression, and whatever whatever symptoms I have, I blame it on anxiety. At least that's my that's what I think. So today I gave up. I will be called by a nurse. I know I will be they will try to pursue me for trying it again. Either that or I will get some really mean comments. So I'm quite ready for it. But I can tell you one thing. I know I didn't do the 4 weeks plan that was initially that's when you start feeling better. I did not do that because I was going backwards. I was going extremely backwards. I already have issues, and going backwards is like, no, that's not something you want to do. So this was my Rtms story until now. As far as I know, I have stopped it, and I do not think it suits me, and I do not think it suits people who has GAD, GAD, or who has anxiety. These two main things I do not think, but I'm not a doctor. I'm just a person, who went through this. But if you're tired a lot, That can be a issue as well, and also if you suffer from migraines and all, that can be increased as well by this therapy. But yeah, the ones who are working with this therapy, they do not want to hear something negative. But this was my story about RTMS. If I have any other updates, of course, I will let you know. And I love you as usual. Lots, lots, and lots.